We're going to position for SI joints or sacroiliac joints. We'll start with the apiaxial, which is cephalic, an angle. We're going to angle 30 to 35 degrees, depending on your patient or the steepness of your sacrum. Normally I angle 35 for females, and that's what I'm going to use right now. A 35-degree angle. Make sure the patient's straight. And I'm going to place my central ray at the mid-sagittal plane and about 1.5 inches superior to the pubic symphysis. Now you can also go palpate for the ASIS and go down about 2 to 2.5 inches below the ASIS. That would put you right about 1.5 inches above the pubic symphysis. Once we have that, I'm going to ask the patient to hold their breath and breathe. And then I will go ahead and use a perpendicular beam for the obliques. Go back up to 40. Make sure I'm centered to my bucky. I have a marker. And I will oblique my patient between 25 degrees to 30 degrees. The SI joint of interest is the upside. So in this case, if I'm doing an LPO, the joint of interest is the right side. Making sure my patient is nice and straight. I'm going to reduce my collimation from 8x10 to 6x10. I'm then going to palpate for the elevated ASIS, just about there, and bring my central ray about 1 inch medial to that elevated ASIS. Then I'm going to ask the patient to hold their breath and breathe. I will then go ahead and do the opposite SI joint for comparison. Again, 30-degree angle, or you can do 25 to 30 actually. It's not as steep as 45. Feel for the elevated ASIS and bring your central ray 1 inch medial to that elevated ASIS. We're using again a collimation of 6x10. I'm going to ask the patient to hold their breath and breathe. You could also do these PA. But in this case, we're only going to do them AP.